Hello and welcome to House Calls Real Docs Real Talk. I'm your host, Mercedes Fuller. Well, it's February, and February is Black History Month. We thought that it would be a great opportunity to revisit the topic on health equity, an issue that we're laser focused on right here at the American Heart Association, and with good cause. Did you know that Black Americans experience nearly 30% higher death rates from cardiovascular disease and 45% higher death rates from stroke compared to those non-Hispanic white Americans? That is not equitable. Today, we'd like to examine the root causes of this and offer some solutions. With me this morning is Dr. Mercedes Carnethon, professor and vice chair of preventative medicine at Northwestern University's Feinberg School of Medicine. Dr. Carnethon, welcome. And I like that first name. It sounds kind of familiar.
I have to say, I think that our family members had equally excellent taste.
There you go. I agree with that. Welcome to the show this morning. Let's jump into today's discussion with health in the headlines. Good health is always newsworthy, so each week we select one current headline that ties back to the topic at hand, and then we ask our experts to respond. This week's entry comes to us from AHA's newsroom, and the title is kind of grim. The title is this: Hospitalized COVID-19 patients from socially vulnerable neighborhoods may be more likely to die. Dr. Carnethon, what are your thoughts on this?
This has been a really devastating observation that we've seen throughout the pandemic. Some of the reasons why hospitalized patients who are coming from our vulnerable communities are less likely to survive and thrive is in part because they have a higher burden of the underlying heart disease risk factors and heart disease. We know that people who've had prior heart attacks and or strokes are more likely to have bad outcomes, along with those who have diabetes. We also know that people who live in vulnerable communities often have less access to healthcare, so they may be presenting later when they do contract COVID-19. But no matter what we have to really focus on is what is it about our communities that is threatening our health and leading to that higher burden of heart disease risk factors. So I hope that we'll have a chance to talk about that further.
Absolutely. Such an important topic to dive into just a little bit more. Let's jump into some of these topics when we go into our segment that we call You Ask, We Answer. Doctor, we have a few questions in the queue for you, so let's jump right in. Our first question comes to us from Fred in Chicago, and this is what he wonders. Why is it that heart disease and stroke risk factors disproportionately affect Black Americans?
One of the reasons the risk factors tend to occur more often in Black Americans is because of the environments and communities in which we are exposed. Picture, for example, the young child who grows up in a safe neighborhood with a large backyard where they can go out, play, and get exercise and walk around. And then picture a contrasting picture, a young child growing up somewhere where the neighborhood isn't safe due to crime, where the playground equipment isn't safe for them to play on. Those children growing up in that environment may be more likely to stay inside, watch TV, and eat snacks. And we see this divergence in risk factor patterns happening in youth. So it really does start with that child who has more or less access to exercise. And then as we age, this ends up magnifying over time. Adults who have jobs that don't allow them the free time to be able to exercise in their time off, or that don't provide enough income to purchase healthy foods, those people choose less healthy diets that put them at risk for high blood pressure, obesity, high cholesterol, diabetes, the ABCDs that we know lead to heart attacks and strokes.
Mm, that is so critical, doctor. And I love how you break that down, the ABCDs. That's amazing. Thank you for shedding light on that. Two different realities that we have to pay attention to. So thank you for that, doctor. Here's another question, and it's coming to us from Esther in Los Angeles. And this is what she wonders: what are the social determinants of health?
That's a great question. And thankfully, those have gotten a lot of attention. It used to be that one of the earlier theories is that we saw differences in health outcomes between Blacks and whites, or Asians and whites, or Latinos and whites, due to something genetic or biological that's different. But what we've really learned is that it's the social and cultural environment that surrounds us that's leading to these health inequities. So, the social determinants of health are some of the things that I provided in the earlier example. What sort of access do we have to health promoting versus health harming risk factors? What is our access to income to be able to afford to make healthy choices for ourselves and for our families? What is our access to the healthcare system, and how are we treated when we're in the healthcare system? These are social and cultural factors that drive what happens to us throughout our lives, which really lay the foundation for developing the leading cause of death in the United States, which remains heart disease.
Doctor, you said one word that you said a few times that's so important that we consider when we have these types of conversations. You said the word access, so important. So thank you for lifting that in that answer. Here's another question that's coming to us from Grady, and he wants to know, what is the effect of COVID-19 on the Black community?
Unfortunately, the vast majority of the inequities that we're seeing in COVID-19 outcomes, these have really been borne out by the Black community and by other communities of color. Because of a higher burden of the underlying risk factors that lead to poor COVID outcomes, we are seeing higher rates of death in Blacks as compared with whites and in other communities of color. And this, unfortunately, we had hoped that this would change when we had access to vaccination, but due to historical abuses and vaccine hesitancy and even access to vaccines, we didn't see the same level of uptake of vaccines in the Black community that we saw in the white and Asian communities. And as a result, even now, when we have this relatively milder variant, we're still seeing high rates of death among those who are not vaccinated. And unfortunately, the Black community has lower rates of vaccination. So I hope that this serves really to remind us of the role that we can try to play in making people aware of strategies to protect themselves from COVID-19.
Absolutely. Thank you for sharing that, doctor. We all play a part. I love that. Red has this question. He wants to know, what is the relationship between mental health and physical health? Another important question, doctor.
That's a really important question. And a lot of times people try to think about these as separate issues, but mental health is health. And you think about the ways in which impaired mental health and mental wellness, psychological distress informs our decision making and our ability to overcome barriers. So picture the person who is, mildly depressed, not even necessarily clinically depressed, but who is lacking motivation. And that motivation means, the absence of motivation can make it hard to want to get up and do stretching exercises in the morning. That motivation can make it hard to stick with the discipline of having a healthy meal to start the day. And then every insult coming after that is even harder to deal with. And it's something that we don't spend enough time talking about in our communities, mental health, because of the stigma of having a weak mind. And we have perpetuated this somewhat by really celebrating the strength of our community against various adversities. But part of that strength needs to be admitting when we need help and reaching out to get that help, because mental health is health.
Absolutely. I love that. Mental health is health, and we need to reach out when we need our help and our
Mhm.
support. That is so critical. Thank you, doctor. Here's another question coming to us from Elizabeth, and this is what she wonders: how are Black women affected by mental and physical health issues?
Black women suffer the same, we a lot of times will think about depression and other mental health issues as some other community's problem, some community that's less strong. But this is where the strong Black woman motif falls apart. If the strong Black woman doesn't feel that she can reach out and get help, then she suffers in silence and we end up with tragedies. Black women do commit suicide. Black women do suffer ill long term health effects due to neglect, making bad choices, perhaps because we don't feel that we deserve better. All of these issues need to be addressed. We deserve the same as any other community. Certainly, there are barriers that we are facing that perhaps some other communities aren't. But, really, until you walk a mile in someone else's shoes, you have to be aware that everybody faces these challenges, including us. And so I think it's really important that we reclaim that and get back to our own mental health so that we can protect our physical health and support our friends and family.
Absolutely. Absolutely. We have another question coming to us, Doctor, from Lamont, and this is what he wonders. What can we do to address these health inequities?
That's a really challenging question because, as I pointed out earlier, they don't always arise from the individual. And these inequities are not the fault of an individual flaw or limitation. We need a comprehensive view. We need a comprehensive view that says, I'm going to advocate for safe spaces in my community to be physically active, that says, I'm going to speak up to my workplace to say, hey, can we stock the break room with something healthier? Or if we're working remotely, can we do certain challenges to say, hey, for this hour, no meetings. Let's stand up and become physically active. It's going to take a multi-pronged approach that focuses outside of the clinical and healthcare setting, because that's not where these inequities have arisen. They've arisen because of differences in the social determinants of health. So it requires a broad perspective to be able to address and ameliorate them.
Absolutely. Absolutely. I like that. We have to take that multi-pronged approach. So important, so critical. And you provided so many great examples of what we can do. And I think I might have to talk to some of my leaders about that no meeting hour and doing something a little physical because we've been.
Mercedes, I hope you get up and do some jumping jacks after we get off here.
Absolutely, I will. I'll do at least 10. That's my promise. Our last question comes to us from Donna. She wants to know, what is Reclaim Your Rhythm, speaking of those jumping jacks, and how can I participate?
I love it. So, Reclaim Your Rhythm is a really exciting program that's encouraging people to do something that brings joy to them. On the one hand, it is an opportunity to get up and move. So, there is a playlist that calls upon many of our favorite songs and music that we can use as individuals or families to get up and take a dance break. We had a great time as a family last night for Valentine's Day, where we all decided to do a dance. Every member of our family got up and did a dance. My heart was beating. I got a little bit of a workout and we had a ton of fun. And then on the flip side, there are songs and a soundtrack to promote meditation. Thinking about calming your mind at the end of the day, calming yourself before you walk into a stressful situation. All of this is part of reclaiming your rhythm, your mental health, and your physical health.
So, Doctor, what you're telling me is I can go to this playlist, play some music as I do those jumping jacks.
That is exactly what we want. Reclaim your rhythm, Mercedes, and send me a video.
Absolutely. Okay, so I'm accepting that challenge, and
All
I'm going to
right.
see if the production team is going to join me in that challenge since they're in the background laughing at me. So, Dr. Carnethon, you have been amazing. It's been great to talk with you today, and thank you so much for just shedding so much light on this very important topic of health inequities. And sadly, this is a tragedy that we're facing, in the sense that someone's zip code should determine their life expectancy. Surely we can do so much better than that. And I think that with your advice, we will. Is there anything else that you'd like to add before leaving us on today, Doctor?
Just that you should do things that bring you joy. A joyful heart makes for a healthy body. And even when you're facing challenges, push through, find something to do for yourself every day that brings you joy.
Absolutely. Let's go after that joy, Doctor. Thank you so much for joining us, and we look forward to having you in the near future. Well, friends, that does it for our show. I have some jumping jacks that I got to get ready to do. So as for you, you can go back and check out any of our previous episodes by going to our House Calls YouTube playlist. Please be sure to subscribe and share all of this good information with your friends and family. Take care of yourselves and each other, and I'll see you soon. I got to go do my jumping jacks.
Get it, slip it, cuff it, check it. Talk to doctor now and share it. Get it, slip it, cuff it, check it. Talk to doctor now and share it. Gonna get it, gonna slip it, gonna cuff it. Check it, talk to doctor and share it. Gonna get it, gonna slip it, gonna cuff it. Check it, talk to doctor and share it.
Get it, slip it, cuff it, check it. High blood pressure silently affects millions of Americans. Staying on top of your blood pressure is as simple as these 4 easy steps. Self-monitoring is power. Visit manageyourbp.org to learn more.
Learn more about House Calls, Real Docs, Real Talk, and submit your questions at heart.org/housecalls.